Taste the Mediterranean through March 19th at Whole Foods Market. Save on animal welfare certified bone and beef short ribs, sustainable wild-caught sockeye salmon, and more. Find sales on Parmigiano Reggiano, charcuterie and ground lamb. Grab an olive boule bread from the bakery. Plus, wines from the Mediterranean start at just $8.99. Taste the Mediterranean now at Whole Foods Market. Must be 21 plus. Please drink responsibly.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by our amazing pediatrician bestie, Dr. Anthony Porto. Hello, Anthony.
Hi, Jess.
All right, so today we are going to talk about constipation. The clock is ticking, so let's get to it. Anthony, let's start by understanding constipation. What exactly is constipation in children?
So constipation in children is really defined as a delay in or difficulty with passing stool that lasts for 2 or more weeks. It's a widespread issue, and it affects about 1/3 of kids. In my practice, about 40% of our visits is due to constipation.
Okay, so parents often wonder how to recognize constipation in their children. What are some of the signs that we should be looking out for?
So I think there are 3 main things to keep an eye on. First is changes in stool frequency. Next is change in consistency. And then the third is ease of passage. So each child is unique. So in terms of normal stool frequency, there's not one exact number you should go at. Some kids go every day, some kids go every other day. But if it's a change from what is normal, that's a concern. So you really also want to pay attention to the consistency. Are the stools hard? Are they showing signs of discomfort when they're or straining? And that's really thinking about the ease of passage. Other questions I like to ask is, how long does a child spend in the bathroom? Are they really going to the bathroom, or are they using an electronic device and that's why they're in the bathroom? So limiting that. Do they feel fully empty at the end of a bowel movement? Do they see blood? And have they ever clogged the toilet? And these are cues that there may be something going on.
This is very timely because my daughter just clogged the toilet yesterday. Sorry, Sophia. So, Anthony, what's the most common cause of constipation in children?
So really, functional constipation is the number one cause. And what this means is that there's no underlying medical or anatomic reason for the constipation. And we talk about infants having rectal confusion, right, due to poor muscle coordination. But in toddlers, they may experience functional constipation when they're potty training. This is when they learn how to withhold stool by holding and clenching their muscles. And as they withhold stool, the colon can stretch in size. And this allows the colon to now accommodate and retain more stool. And then the cycle just continues where they're able to withhold. Then there can be more stool in there. Sometimes you may have diarrhea as stool may override some of this constipation. And then it's hard to sort of break that cycle.
And Anthony, I shared with you, I just dealt with this with my son. It was actually constipation that was leading to diarrhea issues. So interesting. So are there specific signs and symptoms that parents should be aware of?
Absolutely. So I think looking out for abdominal pain or bloating, I would think abdominal pain is probably the most common presenting symptom. Changes in appetite. Diarrhea, again, as I said, because this looser stool can override the harder stool. And this can also lead to stool accidents known as encopresis. Your child also may have bedwetting, whether it's at night or during the day. And these urinary accidents occur because the extra poop inside your child's belly is pushing against the bladder. So the bladder then fills more quickly, and this allows accidents to occur. You can also check for rectal fissures. So there may be pain when they defecate because of that, as well as rectal prolapse. And this is really from hard stools and pushing. So if you notice these signs, seeking medical advice is really important.
Poor babies. So how is constipation diagnosed in children?
So I usually diagnose patients based mostly on a history and physical. We may include an abdominal exam as well as a rectal exam, just to sort of make sure there's nothing going on anatomically. And also to check for an impaction. Additional tests can include ultrasounds as well as x-rays, and this can provide more information basically into how much stool there may be in the colon, as well as how successful the treatments are.
So, what are some diet modifications that might help resolve constipation in kids?
So, in terms of dietary modifications, we usually start with focusing on hydration and fiber. In terms of hydration, I typically recommend 1 cup or 8 ounces of water per year of age. So, and this is up until about 8 years. So, an 8-year-old would need about 64 ounces of water. And we find that most kids are not getting that. In terms of fiber, we use age plus 1. So the average 5-year-old would need about 6 grams of fiber, the average 10-year-old about 11 grams of fiber. And this is just helpful so that we can give an estimate. We don't really want to go from 0 to 100. So if you have someone who's taking about 4 grams a day, we slowly increase that number of fiber. And the same thing is true with water. If you have a child who drinks about 16 ounces a day, let's go to the goal of 24 until we can get to the goal for that particular age. Regular exercise is also helpful, and then limiting the constipating foods like bananas, rice, and dairy that can have a significant impact.
This is so interesting and helpful. So, what if dietary changes aren't enough? Are there medications that could be used?
Yes. So some children may need more chronic therapy. So medications include stool softeners, and these are things that are going to bring more water into the colon. This is usually in the form of magnesium or Miralax. Lactulose is another example. Another type of medicine are stimulants. These are Senna or Dulcolax, and these are helpful in kids who have chronic constipation to help give them the increased sensation to go so they can better empty. And then sometimes lubricants like mineral oil can be helpful. We may, in the beginning, ask families to use enemas or suppositories, but this is very limited use. And the medications, again, will allow for the colon to completely empty. And then because it's empty every day, the colon will then return to its normal size so that children will eventually have the sense to need to go to the bathroom on their own.
Wow. Well, I learned a lot. We hope you learned a lot, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.